In this video, we're going to be learning a little bit about the region called the root of the neck. Technically, we can say that the root of the neck is a junctional region between the neck and the thorax, and between the neck and the upper limb via the axilla, as you can see over here. The way that we have a communication between the thorax and the neck is actually via an opening, which is called the superior thoracic aperture. I can roughly outline it here with this pink pen, and we can also name the features that constitute the boundaries of the superior thoracic aperture. So if we think about all the boundaries of the superior thoracic aperture, we can see that posteriorly we actually have the T1 vertebra, so that will be this one down here. Anteriorly, if I move it over here, you can see that we have the first rib. See how it curls underneath the clavicle on the right and of course then also on the left side. Anecdotally, this is actually the reason why you can't palpate the first rib, because, well, it's kind of hidden below the clavicle. Yeah, so the clavicle is obstructing the palpation ability of the first rib, so to say. And you also have the superior border of the manubrium down here, which is the anterior border of the superior thoracic aperture. If we have a superior thoracic aperture, as you know in anatomy, the name is usually the game. That means there has to be an inferior thoracic aperture, which would be down here then. That would actually be the opening and the connection between the thorax and the abdomen. It's not really an opening, there's the diaphragm there, but there are a couple of openings, like some hiatuses that pass through the diaphragm that'll allow, for instance, the aorta and the esophagus to pass through, amongst other things that usually traverse together with these large structures. Things that pass through the superior thoracic aperture I've also outlined in this little text box that I've put in here. You can see, for instance, the trachea passes through. Posterior to the trachea is the esophagus, this muscular tube. Then you have large arteries and large veins. You have nerves, for instance, the vagus nerve and the phrenic nerve. And you have some lymphatics, which I've actually, to keep the picture a little bit tidier, I've hidden the lymphatics here, but you actually have the thoracic duct and the right lymphatic duct that would also be passing through the superior thoracic aperture. If I take our anatomical model here and rotate it sideways, that we can look into the axilla, we might be able to appreciate that the axilla has an opening, or kind of serves as a conduit for all the major nerves and vessels and lymphatics that pass between the root of the neck, then through the axilla and the upper limb. The opening at the apex of the axilla is actually triangular in shape. That is easier to depict in an image. However, the boundaries would be your clavicle, the first rib, again, which we can see up on top, the superior border of the scapula, which we have here. So the superior border of the scapula would be running along here, and passing through the axilla, as you can see right here, is going to be these nerves, which are all parts of the brachial plexus, the subclavian artery, which turns into the axillary artery as it enters the axilla. If I follow this up here, we can see back there is the subclavian artery, and the subclavian artery can be divided into three parts. And along with that, we also have, parallel to the subclavian and then the axillary artery, we have the axillary and subclavian veins. If we look at the aperture, so the superior thoracic aperture, and focus down here onto the lungs, there's an important little factoid that you should really be aware of, which is that the apex of the lung, as you can see up here, it's also called the cupula. Okay, so this will be covered with pleura, which is this membrane that lines the lungs. You have a visceral part which cannot be peeled off, and a parietal part that will be lining the internal aspect of the thoracic cavity. Well, the cupula of the lungs will extend above the first rib, or basically, in other words, you can realize here that the apex of the lung and the cupula of the pleura that covers it will project all the way through the superior thoracic aperture and into the root of the neck on both sides. So bearing that in mind, your first clinical correlation for the day is that if you think about penetrating wounds, for instance a gunshot or a knife wound, and these things are unfortunate but they do happen, if these types of injuries involve the apex of the lung, of course they can allow air to escape into the pleural cavity, which will lead to air in the pleural cavity, which is called a pneumothorax. Yeah, and that will then lead to collapsing of the affected lung, or actually it'll lead to atelectasis of the affected lobe of the lung. In the root of the neck we have a couple of very important major arteries. Okay, to do that I'm going to go ahead and hide all the other organ systems and only leave the arteries left over for us. So what you see now is basically just our vascular system stripped down to only the arteries, and you have here the arch of the aorta, and one of the first parts that comes off of the arch of the aorta is the brachiocephalic trunk. Right? You have the brachiocephalic trunk, which, as the name implies, think brachia means arm, cephalon means head, so it is a trunk that'll supply the arm and the head. Okay, the next artery that will be coming off here is going to be your left common carotid artery, and then you have your left subclavian artery. Okay, you actually have two arteries coming off here that will go to the left side of the body, because on the right side you have this trunk that is larger that will then actually form the parent artery or the parent vessel for the common carotid artery on this side, whereas on the left side it comes off directly from the arch of the aorta, at least most of the time. So your brachiocephalic trunk, as we see it here, enters the root of the neck, where it will divide into your right subclavian artery and the right common carotid artery. The subclavian artery will then continue. It actually has three parts, and after its subclavian artery it'll turn into the axillary artery, and after its axillary artery and goes into the arm is called brachium, so it will then be the brachial artery on the right side. And the same pattern we can also recognize on the left side. So having added in a couple of muscles as well here, here's the important landmark muscle, which is the scaleneus anterior or anterior scalene muscle. Now we can see that the subclavian artery can be divided into several parts, actually three parts, based on how it relates to this muscle. So here you can see that the first part, or the first portion, extends from the origin of the subclavian artery all the way to the medial border here of the anterior scalene muscle. The second part is very small, as it lies just behind the anterior scalene muscle. And the third part will extend from the lateral margin of the anterior scalene all the way to the outer border of the first rib, where it will then become the axillary artery, just about here. Thinking about the branches of the subclavian artery that it has coming off of the first, second, or third part, they're going to be as following. You can see it coming off the first part, this artery here, this is the vertebral artery. And one interesting little factoid about the course of the vertebral artery is, well, you see that you have in the vertebrae of the cervical region, there's a hole here, or a foramen. So, well, the vertebral artery will enter through a transverse foramina and go upwards by passing through the transverse foramina all the way up until it actually ends up within the cranial cavity. Once it's up in the cranial cavity, it'll join the artery, or the vertebral artery, from the other side, form what is called the basilar artery, and ultimately help it forming the circle of Willis, which is this very, very important vascular circle or vascular ring in the cranial cavity, without which life as we know it would not be possible. Also coming off the first part is your internal thoracic artery, which you can see here. It's also called by some the internal mammary artery. Yeah, that'll kind of run caudally behind the ribs, give off some intercostal branches for the intercostal spaces here. There might be some perforating vessels towards the breast and terminating in the superior epigastric artery further down here, and the musculophrenic artery, which goes to the diaphragm. And the third little branch that comes off here is called the thyrocervical trunk. And the thyrocervical trunk is very, very short in itself. It'll divide into the inferior thyroid artery. It supplies the thyroid starting at its inferior pole. The suprascapular artery. And the transverse cervical artery. After this we have the second part, and to find the second part we have to look behind the anterior scalene muscle. So why don't we go and do that. Let's kind of dive behind here and see if we can find our costocervical trunk. And lo and behold, here it is. Most of the time it does come off the second part. Sometimes it actually does come off the first part as well. But here's your costocervical trunk, and what it does, it actually splits into the superior intercostal artery and the deep cervical artery. It'll arch somewhat posteriorly, as you can see here, over the cervical pleura of the lungs and towards the neck of rib number 1, which is over here. Next is the third part of the subclavian artery. So from the third part, at least usually in the software here, it's depicted as a variant, but usually you would have the dorsal scapular artery, which is highlighted here. You would usually have the dorsal scapular artery highlighted here in pink, and it would be going all the way over here. You can see how it supplies the medial margin of the scapula, goes all the way down here, but usually it would actually be coming off the third part or the second part, and so here we actually can't see the dorsal scapula coming off the third part, so we're actually dealing with a variation here, as it is in this case a branch off of an existing artery, which would be the transverse cervical artery. Okay, so now let's try to come full circle here and summarize everything we know about the subclavian artery in its usual variations. There are 3 parts of the subclavian artery. It is important to know that these 3 parts are defined by its relationship to this important muscle here called the anterior scalene muscle. Right? This is the anterior scalene muscle. That means behind it you're going to have the middle scalene and then a posterior scalene in that case. Usually the first part of the subclavian artery has 3 branches, and that will be your vertebral artery, your internal thoracic artery, also called the mammary artery, and then this here, which is the thyrocervical trunk. The thyrocervical trunk actually then bifurcates, as you can see here,